New at 6, preventing crimes before they occur. That is the goal of a unique center opening at Georgia State University aimed at stopping sexual violence. Joe Hankey spoke today with the researchers behind the center about their efforts and their focus on high-risk communities. Joe?
Jeff, behind the scenes, the researchers at Georgia State have been working on this for several months. The university publicly announced the new center today and believe it can have a far-reaching impact.
Sense of taking care of one another, that can actually reduce sexual violence as well as suicide, as well as domestic violence. And so we're really taking that integrated approach.
That is why Dr. Elizabeth Mosley, a clinical assistant professor at Georgia State University, believes the newly founded National Center for Sexual Violence Prevention could have a ripple effect. She says the center is zeroing in on sexual violence prevention, though, and they're already working on several projects with high-risk groups such as military members, college students, and adolescents. A federal report from the military found in 2018, 20,000 service members said they were victims of sexual assault that year, and sexual assaults against women in the military increased by 44%.
There's certainly been a big push by Department of Defense both to measure and track sexual violence and to provide that adequate response to survivors. But now even more, they're talking about sexual violence prevention in the military.
GSU's center is now working alongside the Department of Defense to develop a training and education program the military can use in an attempt to eliminate sexual assault within its ranks.
There's been a heavy emphasis on the response to sexual assault and sexual violence. Of course, that's much needed. But what this center does is really think more upstream about how we can prevent sexual violence.
Thinking upstream includes working with adolescents. As a younger generation's minds are still developing, GSU is researching the impact of using teens' primary care doctor visits to approach topics and develop positive social norms and attitudes toward alcohol and drug use and sexual consent. Those are two of the projects already underway, with several more also in the planning stages.
Georgia State has been a leader in sexual violence research for decades now. And so it's just kind of an opportunity to sort of bring all of those efforts together in a centralized space and really work together to focus on this issue.
And as with any organization attempting to prevent an issue from occurring, measuring success here will be challenging. Dr. Mosley, though, tells me they are able to collect certain data of reported and estimated sexual violence, suicide, and other topics. They'll be able to help them track if their work is having an impact. Jeff?
All right, Joe, thank you.